Senator, for all of Kings Cove, Alaska.
Thank you, Mr. Chairman. And Secretary, welcome to the committee, Dr. Clancy. And I appreciated the opportunity that we had to visit last week as you kind of walked us through some of the changes. And I was so appreciative that you took the time to visit with Catherine Gottlieb, who, of course, is a not only an Alaska leader, but truly a national leader in innovation and working between systems, federal systems, whether it's IHS and VA, but to really provide for an innovative level of care. I'm excited about this proposal. And Mr. Chairman and Ranking Member, and to our august Vice Chair, she didn't hear that. I do think that at some point in time it would be wonderfully instructive for this committee and those of us who are focused on the VA healthcare benefits for our veterans around the country to understand the very, very innovative models that we are utilizing in Alaska, where given large spaces and limited facilities, we are figuring out a partnering through systems, working through the IHS, working through many times our community health centers, and it is providing a level of service to our veterans that is immediate. We're breaking down some silos, and working with the Secretary here, I think we can look to some models that may work in rural parts of our country that will provide the benefits that our veterans have so honorably earned, but in a way that is good care, that we call it care closer to home. And I don't know about you, but when I'm on the road, I'm always sicker when I'm away from home. If I can get back home where you got family and with our native people being with their native foods, being in a place that is comfortable. So it's something that I'd like to talk to the committee about further and let you know what we are doing. Now, in that vein, Secretary, and Dr. Clancy, you can also jump in on this. We do have these partnerings that are going on, and I think the range of choices is good, but I also recognize that we are still offering range of choices within systems that still have their structure. I worry about moving of records and sharing of data and really making sure that these separate rules within these differing programs don't cause more confusion and thus limit our veterans in terms of their abilities to access these. So either Dr. Clancy or Secretary McDonald, can you give me any greater assurance as to how we're coming along with a more fully integrated system with this very unique model that we're seeing play out in Alaska?
We have a lot of work to do together to get to a single model that's integrated. Let me give you one example. We have 5 different ways that a veteran can get care in the community. Of those 5 different ways, each one has a different reimbursement profile. Right. So when Senator Tester and I were in Montana, and he organized a town hall meeting of providers, doctors, hospital systems, and so forth, everybody there wanted ARCH. They loved ARCH as a system. Well, ARCH pays Medicare Plus. Choice, PC3, pay Medicare, Medicare Minus. So everybody loves ARCH, but they don't love the others. So to get to the right integrated system, we need to get all the providers on board. To get all the providers on board, we need to go to one integrated reimbursement system, one integrated system, and we're going to put that together and come to you and hopefully get that passed so that we can have no question is to get the providers on board and the veterans having a place to go outside VA.
Well, the sooner that can be done, I think it is to the veterans' benefit.
Absolutely.
The one point I would just add, in Alaska, what is working well are our sharing arrangements with the tribal health services. Yeah. Alaska is probably the most enthusiastic proponent and user of those agreements, so we're thrilled about that. About $10 million from VA has gone to those services.
Well, I appreciate that, and we'll know that we want to work with you. I will just make one comment, where we had an opportunity to sit down and talk about this regional alignment or the realignment. And I have to tell you, I am concerned because as I look at these these divisions, it seems that we're getting bigger. It looks like the territory that Alaska is in is almost identical to what the Ninth Circuit U.S. Court of Appeals looks like, and we've been fighting to break that up for a long time. So I'm just sending the heads up to you that I'm concerned that when you have one region that's covering thousands of miles, 3 different time zones, the concern that the regional offices will be able to provide for that level of care that our veterans expect. I'm sending out the signals. I have several different questions that I would like to ask. We've talked a little bit about how we're focusing on reducing the backlog, and I know it's always about numbers, but at the end of the day, for the veteran, they want to know, have you heard me? Have you sat with me? What kind of care have you provided me? I know that my caseworkers in my offices back in Alaska work hard, and we're not pushing them to close out constituent cases, boom, 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 and we're assessing you on that level. Sometimes it's hard, but when we have one great success with our veterans, it makes our staff feel better, like they've really provided a service. I'm concerned that as we focus on, we got to reduce the numbers, we're forgetting the customer service. And as we forget the customer service, we're forgetting not only the satisfaction to the veteran, but the satisfaction to the VA employee who gets great personal satisfaction in knowing that they have provided a level of care. They've fixed a vet's problem today. And if they can't feel that they're doing that, if they feel that they're just processing numbers, the difficulty in recruiting and retention is going to continue, which means that our backlog is going to continue. You're nodding because
We agree
I know
with
you agree.
We agree with you entirely. I mean, this is why we're all doing this. It's not because of the stock options you get from government. I mean, you know, we're doing this because of the inspirational mission that we have of caring for those who have protected us.
And we can't ever lose sight of that.
We can't lose sight of that. It's more than numbers. It's the picture of the gentleman behind you. Every one of those we feel, it's exactly the reason I gave out my cell phone number during the first national press conference in September, and I take calls every single day from veterans, and I listen to them because you got to keep that visceral empathy of what we're trying to do. It's all very personal.
Well, thank you for your dedication. Thank you, Mr. Chairman. And I do have some questions that I'll submit to the record.